Welcome to the ICD-10 workshop. Today's workshop, titled Ready or Not, Here Comes ICD-10, Developing a Transition Plan for Your Practice.
I wanted to introduce myself to those of you who are brand new to joining us today. I am Kelly Whittle. I'm the owner of Whittle Advisors, and I do ICD-10 transition planning, not only for hospital systems, but for clinics and physician practices. We will make this transition. There are a few exceptions. Some of you will make the transition slightly prior, like in long-term care, home health, and some cases when we have serial prescriptions at a pharmacy, we'll need to capture both I9s and I10s prior to the transition. I'm going to present a very high-level ICD-10 overview. By show of hands, how many of you have been working with this regulation already? Okay, about half of you. Great. Any questions that you might have, any confusion or concerns as you move forward, I am available. I do provide you with my contact information today, and I welcome you to reach out. Jenna, let's go forward. An ICD introduction. ICD stands for the International Classification of Disease. 9 is the 9th revision, 10 follows, that is the 10th revision. This is a classification or taxonomy that's owned by the World Health Organization. And as many of you already know, most of the developed world is using ICD-9s and 10s in some way. The United States is the last holdout using ICD-9s. One of those reasons is because we use ICD-9s differently than most of the rest of the world. Our ICD-10s have to be used not only to capture our diagnosis codes to use for statistical reporting, quality reporting, but we also use them to base our reimbursement on. This required about a 10-year modification to ICD-10. So it's a ton of work. It's a huge expense for the United States to make the transition from I9 to I10. Here on the slide, just a couple of things to point out. The reason I10 is so valuable to us in the United States is that it is the foundation of healthcare reform. ICD-10 and the detail that it will provide to us as a nation allows us to do all of these things. It's required for accountable care organizations to determine what the risk is in association to a certain demographic population. That population's risk and cost is much different if you're dealing with geriatric patients than if you're dealing with young, urban, career starting patients. Meaningful use certainly picks up a lot of the detail that will capture in ICD-10. Reimbursement. We all know that reimbursement is getting compressed while the quality of care and outcomes are being scrutinized. Our health information exchanges, these are vast data sets gathered either at the state level or the national level. Certainly data mining and technology advances are helping us in the HIE world. What that means for us as an industry is that in the future, audits. We have to prove that the care that we say that we gave was really given. And then finally, our accountable care legislation and insurance exchanges. The real key here is that clinical specificity captured through ICD-10 will become the basis for healthcare reform initiatives. And these are just a handful of initiatives that are coming toward us today. There will be more in the future. So prepare. Change will become common in the healthcare industry. ICD-10 CM-PCS, obviously this is a new coding system, but understand that it's not just a revision, it's a new coding system. While ICD-10 CM impacts those here in the room, PCS is really important for our facilities. At the top, the real point is we need to use the codes to tell the healthcare information story. You have to know what your patients are presenting with. We have to know what the clinical thought process was of your providers and what type of care was given. If you know the statistics of this coding change, ICD-9 diagnosis codes, there are about 14,000 of them today. We're moving right up to about 70,000 of them. That's just at the go live. Remember, this code set will be upgraded annually, just like ICD-9 is today. ICD-10 will go through an annual revision as well. Yes, Mary, thank you for smiling. And then on the procedure side, certainly your CPT HCPCS codes are not changing this year. I make an emphasis on this year. But for our procedure codes for inpatient stays, we're going from about 4,000 to 72,000 codes. There's a change in the structure, the coding rules, and in the terminology. Lots of change everywhere. Big points of impact, and we'll talk a lot about points of impact to your practices today. Your business processes will change, your technology will change, your reimbursement rates will change. The key benefits of ICD-10, greater detail, enhanced categorization models. This helps us really to hone in on types of care that are given for types of patients. It's really exciting for research. I did about 10 years with Thomson Reuters in their healthcare division. Many of you might know their 100 top hospitals benchmark. For researchers, this additional detail is like Christmas. We're so excited there to think about what they can do and what they can learn with the additional detail. For those on the front line, it's not so much like Christmas. It's a lot more time to process each patient. The benchmarks and productivity that you build today based on I-9 care, based on the systems and the processes you use, they will change absolutely. Without a doubt, you can expect and will experience productivity loss. So that gives an entire new spin to how we deliver healthcare on the front lines. And we'll talk a lot about that in our series of workshops. And so now we're going to talk about the specific impact of physician practices. The impacts are vast. You know that this is coming. Today, we're going to share with you some points of impact that I've identified. I built the physician practice plan for Trinity Health. Trinity, you might know, recently merged with CHE. Before they merged with CHE, they had 504 physician practices stretched across 10 states, right across the Beltway of America. And so I built a plan for each of those 500 practices. Here, I'm guessing we're probably representing 25 practices.
Probably more like
40. Here we're representing 40 practices, and Andrea can tell you and others can tell you that where you have 40 practices, you have 40 sets of processes, you have 40 ways of doing things. With 504 practices, I had 504 sets of processes and 504 sets of ways to do things. Now that they've merged with CHE, you might be aware CHE Trinity is now the 4th largest healthcare organization in the United States. It is a Catholic-based, faith-based organization, and they care for patients in 21 states. That brought them to about 800 employed physician practices. So the work plan that I'm about to share with you is very similar to the work plan that lots of your colleagues in the nation are using as well. The way we're going to present it to you is across 4 workshops. Many of you learned through the advertisements for this workshop that it is a series of workshops that are iterative. Today you're going to receive some tools and tasks, and if you work through those tools and tasks prior to the next workshop, you'll be able to take another set of tools and tasks in December, a 3rd set of tools and tasks in February, and a 4th set of tools and tasks in April. And by the end of that time, you'll have a very good strategy for making the transition from I-9 to I-10. We're going to give this to you in pieces as to not cause any panic. The changes to your office that we'll talk about, changes to your super bills. If you're using a super bill today that contain I-9 codes, you might have already heard that it is not a good strategy to use a super bill in I-10. Some folks tried to prove me wrong in this recommendation, and they set out to build I-10 based super bills. What they came up with is if they had 1 or 2 pages in I-9, they had 9 or 10 pages in I-10. You can go through this exercise if you like. And I might find the work sessions interesting as you walk through that process. But it's likely at the end of that time that you spent trying to translate those 9s to 10s and capture them all, that you'll have a very large super bill. You will have a big impact to documentation. Many of your physicians today are using EHRs or electronic medical records. They are choosing codes as part of their work process. In ICD-10, you'll hear CMS and others in the industry say, we want our providers to focus on documentation. We don't want our providers to focus on coding. It's a really interesting marriage, and one we'll get into in the second workshop. We'll talk about how will our electronic medical records change, how will it impact our providers, and where can we marry coding, I use that word loosely, coding with technology so that we get the full story. Staff education and training, Cheryl Wheeler will share us lots of information today about education and education strategies and potential tools. It is the foundation for the transition. You have to have the knowledge before you can understand the impact and develop solutions. So if there's anything you take away today, it's the importance of education. Medical necessity is another very big impact for you. It's great if you understand what role medical necessity plays in I-9. It will become magnified. The importance will become magnified in I-10, and we'll certainly address that in our workshops. These changes from here down will be addressed in future workshops, changes to your business processes, the possibility of cash flow disruption. We'll talk about financial modeling in the future workshops. We'll talk about what it is you need to be thinking about and how to prepare. We'll talk about IT system changes. IT is the backbone of our practices today. If you're working in paper, don't worry. We have solutions for that as well if you will not be on an electronic medical record by October 1st, 2014. So we can address the need for paper transition. And productivity loss. As I spoke about, we will expect productivity loss across many of our roles in the practice. We'll talk about how to mitigate that. Forgive me for this slide and for the next one. I've broken all rules of public speaking. This is a crazy slide. When you look at it in your packet, it's not likely that you can read it in that half-size sheet. This is an AAPC image. Has anyone seen this before? Yeah, this is a really well-shared, very well-dispersed image coming from AAPC. What I love about it is that right away, from a visual standpoint, you can begin to see the, I'll use this word lightly, chaotic impact of ICD-10 in your practice. It touches almost every space and every role. If you have not seen this, please reach back to me and I'll give you a version of this that you can actually dig into the detail. Our physicians, nurses will be impacted, our managers, the front desk, that's a place you might not have thought, but boy, there's a big impact to those scheduling patients and doing prior auths and medical necessity checks. Our coding will certainly have a practice. Billing, if you have a denials process today, great. If you don't, this is where we're going to build. We expect a large number of denials as we make the transition and payers come up to speed with what they're going to pay for and what they're not. And certainly our lab will have an impact as well. The very next slide is that second slide I ask your tolerance on. This is huge, and this is a documentation sample. This also comes out of the AAPC white paper that I mentioned from the previous diagram. This is a great way to begin to see the amount of detail that CMS is recommending for us to capture. You'll see the storyline is Mrs. Finley. She's coming into the doctor's office. She had a cabinet fall on her last week. This is a new cabinet. The installers missed the stud by 2 inches. She was cooking in her kitchen. It fell off and has caused her residual problems. Now, some of the additional detail is this statement here in orange that says her husband was home with her at the time and told her she was out cold for more than 2 minutes. Wow, do you get that kind of detail today? It might be important in the future because that helps us to verify that she has ongoing problems, helps us to distinguish between chronic and acute problems, the fact that we're gaining some specificity here. She was knocked out for more than 2 minutes or for about 2 minutes. This helps us to come to some conclusions that are very specific. There are multiple digits coming into our diagnosis codes. And so lots of dialog boxes here on the side explaining why these additional details are important. Again, this is an AAPC white paper. I'm happy to put this in your hands. Let's see by a show of hands, who has a designated ICD-10 budget? Thank you, thank you. ICD-10 budget will be important. The ICD-10 transition is not free, it's expensive. It will be expensive to you across multiple segments of spend. I have included a sample budget in your packet or your handouts today. This slide has data that comes from Natch and some advisors. This is a Washington, D.C.-based consulting company. And so he has estimated that for a small practice having 3 physicians, you're looking at, I'm guessing here, somewhere around $70,000 of impact due to the transition. It comes from cash flow disruption. And remember, we'll talk about that in the future. Education, it's not free. Today is free, but it's not likely that all of your roles will benefit from today. There will be roles that can't join us, that need very specific education, like your billers and your coders. Process analysis work, it's time consuming, so this $6,900 is an estimate of what it will cost you to spend time analyzing your process impact. Potential changes to your super bill, your IT costs. If you need an upgrade that is not covered by your existing support contract, you might experience a cost there. And then this big piece of the pie has to do with increased documentation costs. Another way of saying that is lost productivity. Jenna, would you give me 1 second back to the, yeah, here. Who has 10 providers? Anybody here with a larger practice? 10 providers. Okay, so let's take a look here. Lost productivity, we're estimating almost $180,000. That's big. Education, somewhere around 5,000. Cash flow disruption, 65,000. Analytics for process, around 10 or 12 grand. Changes to your super bill, another 10. IT costs, 15,000. Incrementally bigger. Anybody with more than 10 physicians? 20? 12, okay. This will be similar, 10% more or something. Anybody more than 12? Yeah. 20? Yeah. 30? 21. So you're looking at double. Significant amount. It's important to have these budget conversations with the leaders of your practice. It's not intended to cause anyone to panic. It's just intended to establish a realistic impact due to the change of ICD-10. I do encourage you to take a look at that sample budget sheet. I placed on there some of these categories, a few others. As you work through, it's a great way to begin to estimate the cost associated. Okay, Jenna, if you'll go back to slide. I prepared one that is filled in, and we'll walk through what success might look like. Success for your office might look a little different. I encourage you to fill in the success factor chart. It will help you as you make the transition. Net neutral, no net change in revenue. This is what they tell us we can expect, meaning that some procedures will receive a little bit more reimbursement because we've added additional detail to support the coding. And some of our procedures might, or diagnoses might receive a little less. So they're saying in the end it should wash out. Payer readiness. From an industry, we need our payers to be ready to pay us. So who are your payers? Where's your biggest risk? Do you deal largely with Medicaid, Medicare? Those are government systems, and they tell us they'll be ready. Do you deal with Blue Cross Blue Shield? Do you deal with other private payers that are offering commercial policies in your area? As you begin to understand their level of preparedness, you'll start to see where you have risk and where you do not. This will help us as we begin the conversation about cash flow disruption. Reimbursement readiness, certainly understanding how Blue Cross Blue Shield has changed their payment models will be beneficial, and they have. There's lots of information in the industry about Blue Cross Blue Shield of Michigan. They have been very active in this space. In fact, as you know, there was a 1-year delay in the transition. Multiple years before the delay came out, they were already working on their reimbursement models. Trust me, our payers are way ahead, and they're very, very prepared. They might not be going for revenue neutral. It's just a guess, but they might not be. From an operations perspective, stable quality, revenue cycle, key performance, and outcome metrics, it's important to know your operations. If you're making a 5% margin today and it's going to cost you $50,000 to transfer to I-10, what does that do to the margin? Is this going to be a year where you make money, or could potentially this be a year where your practice loses money? All important things to think about well in advance so you can develop some strategies to help offset the impact. Physician readiness, we need our providers to be ready. We need them to understand the additional documentation that's required. If you're using an electronic medical record, that might help us, but I can't tell you today that it will solve our problem. I worked in technology a long time, and I haven't seen it solve problems to that level of completeness. Typically, there are gaps in the process, and as we begin to get the final view of these I-10 compliant systems, we'll be prepared to make solutions for those gaps. That's yet to come. Here at the bottom, minimizing turnover and productivity impacts. How many have heard that they have staff members looking to retire because they're avoiding I-10? How many of you are looking to retire so you can avoid I-10? I hear this all the time. It's not only from coders and billers, it's also from our providers in the industry. As I told you just a few weeks ago, I moved to Northern Michigan. I won't tell you the name of the provider I live next to. But when he found out what I did, he said, "Oh, that is the initiative that helped me determine my retirement date." One key message that we cannot stress enough is the importance that education become your ICD-10 Foundation. Until you understand the magnitude of change, we all know it's big, but until you start to understand the detail of how big this is, you can't begin to do work with your processes, with your financial modeling, as well as with the rest of the transition. Tools and tasks. Here are your step-by-step strategies. When you take your information, your I-10 knowledge, back to your practice, think about who should sit on an ICD-10 team. I'd never recommend that ICD-10 be managed by one person. There's a tremendous amount of work, and much of the work requires strategic decision making. The decisions you make about the transition to I-10 will impact the practice going forward. You need to have group buy-in, and understanding. So while you begin to assemble your team, think about, is it the right time to bring in my physicians, or do they come after we develop some initial recommendations? Timing here is really important. Develop your education strategy. Certainly, we recommend Precise. We've taken a look, Trinity took a look at many, many vendors, and we found that Precise was the most targeted and best laid out education. But if you find a different vendor or a different form of education, by all means, feel free to move forward and be confident there. But education is important. Develop your budget. Some of you will laugh at me when I say this. But think about the cost of I-10. Otherwise, you might be caught off guard several months down the road, and you would hate to be putting yourself in a panic or crisis mode because there's no money to manage the transition. The I-10 mandate isn't going to go away. As much as we'd like it to, it's here, it's coming, and so let's think about it in a strategic manner. Tackle the work plan. That second handout that you picked up today is a very brief work plan. That is your Workshop 1 work plan. When you come to Workshop 2, you'll get the Workshop 2 work plan. At Workshop 3, you'll get a third work plan, and at Workshop 4, you'll get the fourth work plan. These work plans are designed to help you think about the next steps of the program. What do you need to be doing now? And when you see the second, third, and fourth, it's what you should be doing in the future. And then step number 5, register for Workshop number 2. You have that opportunity today. And Heidi and Andrea have made it very convenient for you to do so, to make sure you get a space at those workshops. We are expecting the development of wait lists or filling these workshops over the next 4 workshops. So make sure you get your seat reserved. Okay, thank you very much for your participation today.